wanted to really kick us off here with Director Whitehorn, who is going to talk to us about what she's seeing as in her new role as the Director of Health and Family Services. Prior to this role, as you know, she spent 5 years in the governor's office, managing the healthcare and human services agencies and initiatives from there, including a large role in COVID response and a number of other issues. So we're going to take some comments from Director Whitehorn now and then do some conversation. So I'll turn it over to you.
Good morning. Thank you, Kathleen, for the introduction. I'm excited to be here today, not in Springfield, to help kick off the second annual State of Reform Health Policy Conference. I'm honored to have the chance to talk to you about our work at the Illinois Department of Healthcare and Family Services before you continue your day with what I'm sure will be thought-provoking discussions about a range of health policy issues. I have been leading HFS since January when the governor appointed me to serve as director, following 5 years in the governor's office, as Kathleen mentioned. As first assistant deputy governor for Health and Human Services, I worked closely with the deputy governor overseeing all of the health and human services agencies. In particular, I focused on children's behavioral health, early childhood education, and healthcare policy more broadly. I'm honored to continue working to fulfill this administration's vision that healthcare is a right, not a privilege, and to build on the great work that is already underway at HFS. So I've had the opportunity to meet many of you over the last few months, while others I have not yet had the chance to meet. So I thought I'd spend a little time introducing myself, tying in updates on some exciting new initiatives underway at HFS. I'm a public servant at heart. My dad was a clinical psychologist, and my mom worked as a hospital social worker and a high school secretary. My first job out of college was as a special assistant to the Chicago Public Schools Chief of Staff under then CEO Arnie Duncan. That's where I first learned about the power of government to make positive change in the lives of those who rely on government for critical services, and fell in love with that work. Something Arnie said to a group of young employees while I was there has stuck with me. He had worked for years at a nonprofit serving kids on the south side of Chicago and had viewed CPS as the enemy. So when he was first asked to come work at CPS, he thought he would never say yes. But eventually, he did accept the job, reasoning that he could make more change from the inside than the outside. My first stint at the state was under Governor Quinn's administration as an associate general counsel and then as deputy director for personnel at the Department of Central Management Services. My interest in work in healthcare policy developed during Governor Pritzker's first campaign, where I worked as a policy advisor focusing on Medicaid and the governor's healthcare platform. That's where I began to learn about the power of Medicaid, as well as the gaps that still exist in healthcare access and equity. Health issues impact everyone. On a human level, poor health or a bad diagnosis is simply devastating, no matter who you are. Yet there are long-standing systems that make those issues fall disproportionately on underserved communities, communities of color, and low-income people. The opportunity we have at HFS is to change this. Not overnight, but through all the various initiatives underway and more to come. One thing I learned in the governor's office is that in order to make some of these changes, we need to work across agency lines, because the people we serve through all the many critical programs we run in the Health and Human Services portfolio don't recognize the difference between HFS and DHS and DCFS, nor should they. For them, it's about groceries or health insurance coverage or money to pay rent. We needed to find better ways to make systems work together in the bureaucracy in order to better serve the people who need our help. That is in part why I helped start the Children's Behavioral Health Transformation Initiative. We were regularly hearing about families facing challenges and barriers to finding the behavioral health services their child needed, particularly in complex cases where children had concurrent conditions and the family could not find a residential placement. As a mother myself, I so empathized with parents who were at their wits' end trying to find any resource to help their child, watching as their child suffered and there was very little they could do about it. it was abundantly clear that we needed a system that makes it much easier than it had been for families to enter and navigate and access quality care quickly. These can be situations where a child is in acute distress, and the last thing we want is for additional hurdles and complications to delay or prevent families from connecting with services at such a critical time. The initiative started out as an interagency work group tasked with looking at how to tackle these issues. We brought together experts from 6 state agencies. It's a little bit of alphabet soup, but the Department of Human Services, Department of Healthcare and Family Services, Department of Children and Family Services, the Department of Public Health, the Department of Juvenile Justice, and the Illinois State Board of Education. I tapped 3 agency project managers to lead the team and establish goals and a work plan. They quickly found enthusiasm for the work, but also recognized that we would need more resources to accomplish the goal. That's when we turned to Chapin Hall, who already worked closely with DCFS and brought on a team there led by Dana Weiner. She jumped right in and added the capacity we needed to put together a blueprint plan for transformation, all the while improving interagency coordination as we went. By engaging stakeholders, advocates, families, and state agencies, we honed in on a more refined set of large-scale goals to implement evidence-based solutions to adjust capacity so that we have enough of the behavioral health services we need, streamline processes so that services can be easily accessed, intervene earlier so crises can be prevented, increase accountability so there is transparency in service delivery, and develop agility so we can be more responsive to the changing needs of the youth population. Last year, the Pritzker administration published the transformation plan setting forth the vision and framework for broad improvements to the youth behavioral health system. The report contained 12 recommendations stemming out of robust analysis of service gaps and opportunities with concrete implementation steps. The report also celebrated early successes that we hoped to build upon. I'm proud to say that in the short amount of time since the report was released, we have already seen a lot of progress. For example, the 6 state agencies have worked together to expedite placement and services for youth in need of residential interventions, staffing over 300 cases and resolving more than 3/4 of them. The state is also now partnering with Google Public Sector on Beacon, a new service access portal for youth that will be a user-friendly resource hub, making good on a key recommendation from the Blueprint report. Now, as I lead HFS, I have the opportunity to contribute to this work from a different perspective. As the agency that administers the state Medicaid program, HFS provides comprehensive healthcare coverage for roughly 50% of Illinois' children and is helping to drive key innovations in children's behavioral health care. HFS's role in the Children's Behavioral Health Transformation Initiative include using data and our knowledge about the precursors to youth mental health crises to help our Medicaid managed care organization partners better detect and respond with intensified services to alleviate the crisis before it reaches an acute stage. Assisting with developing a statewide resource referral tool to give adults in helping roles easy access to information about services, and strengthening community networks so that families, service providers, and system partners can communicate about gaps and priorities in their area. I wanted to share my perspective on the Children's Behavioral Health Transformation Initiative, not only because I believe it will improve the situation for so many families and children in Illinois, but because it is a prime example of the change that is possible when agencies work together collaboratively to break down barriers, share information, and formulate solutions. The persistent, difficult challenges of providing behavioral health services for youth are just one example of the types of problems that require complex and collaborative solutions across state government. I'm excited to bring this perspective and approach to the work we do at HFS. Our mission at HFS is to help Illinois residents access quality health care to improve health outcomes, which will ultimately improve the lives of our millions of customers across the state. During the first 5 years of this administration, which included navigating the unprecedented challenges posed by COVID-19, HFS laid a strong foundation that has allowed for increased healthcare access and the implementation of equity-driven policies. But there is much more work to do to increase access to quality, affordable, and equitable healthcare. Let's start with access. This is first and foremost about maintaining coverage for those who are eligible. I want to uplift the massive amount of work that's been done over the past year to keep eligible customers enrolled in Medicaid during the unwinding from the continuous Medicaid coverage requirement, and the return to the standard practice of conducting annual renewals for customers. Our goal from the start has been to keep as many eligible Illinoisans enrolled as possible, and I'm proud to say that not only has Illinois led the Midwest in that effort, we have consistently been among the leading states nationally. The unwinding is nearly complete. To date, more than 74% of customers have retained their coverage. That's nearly 2.7 million people. As you know, this was a major effort that required extensive collaboration and outreach, and I want to thank all of the MCO representatives, providers, advocates, and other stakeholders in the room, along with our sister agency, DHS, for their partnership in this effort over the past year. We increased direct customer communications and launched the year-long Ready to Renew advertising and outreach campaign to reach as many people as possible to ensure they knew what they needed to do to renew their coverage. We also learned a lot, and as we transition back to the normal annual renewal cadence, we are making some of those practices permanent to continue trying to ease this process for our customers and increase access to healthcare coverage. Increasing access to quality healthcare also comes together in our continued commitment to broadly improve maternal and child health outcomes. The maternal health disparities that exist in Illinois, particularly for Black women, remain far too large, as noted in the Department of Public Health's most recent maternal morbidity and mortality report. Because of these persistent issues, birth equity was a major priority for the governor during the spring legislative session, and the legislation that passed builds on work already underway to improve outcomes. Under this administration, Illinois became the first state in the nation to extend full Medicaid benefits with continuous eligibility to 12 months postpartum, regardless of immigration status or how the pregnancy ends. Illinois Medicaid now also covers a second preventive postpartum visit, so moms know they will have coverage for follow-up visits with their doctor at 0 to 3 weeks and 4 to 12 weeks, a critical time frame for prevention, as well as optimizing postpartum health overall. We would not have put these coverage requirements in place without the work of our partners at DPH. Working closely with advocates, we launched the HFS Family Planning Program, which is expanding reproductive healthcare access at a time when it's more necessary than ever, as surrounding states are moving in the opposite direction to severely limit access. This partial benefit program covers family planning services as well as STI testing and cancer screenings for eligible Illinois residents, regardless of their age or gender, who otherwise don't meet the Medicaid income eligibility requirements. And now we're adding new coverage for maternal health provider types and services. Medicaid coverage for lactation consultants will be live very soon, and we continue to work toward activating coverage for certified professional midwives, doulas, and evidence-based home visiting programs. Yay! All of which should be online by the end of the year. We've developed our plans for this new coverage with significant input on best practices from community doulas and home visiting programs. We know that the range of physical, emotional, and educational services these providers will offer our customers will help support healthy pregnancies and positive birth outcomes. By adding these provider types to the Medicaid program, more low-income women, especially Black women, will be able to access these services. We have also increased prenatal and postpartum rates for providers, implemented bonus payments for providers who conduct timely postpartum patient visits, and implemented accountability measures with our Medicaid managed care organizations to improve maternal health outcomes for Illinois Medicaid customers. Access to quality care across the reproductive health spectrum, from family planning coverage to prenatal and postpartum care, is vital, especially in underserved communities in our state. We are excited to partner with DPH to move this work forward in a strategic way as we join together with providers, advocates, stakeholders, and customers to put together a maternal health blueprint for Illinois. Increasing access to equitable health care can be seen in the work we're doing to expand coverage to address health-related social needs and cover services that are not traditionally considered medical and therefore have not historically been covered by Medicaid. We know that it's critical to create stronger connections between non-medical service providers and traditional healthcare providers to address and improve whole person health. Someone can't focus on their health if they're struggling to secure food or a safe place to live, or if they're living with the threat of violence. Understanding the interconnections among health-related social needs underpins the 1115 waiver application we have submitted to federal CMS. If approved, which we are optimistic about, this waiver will allow us to cover these critical services and collect data to show that covering health-related social needs improves overall health outcomes for our customers. We are looking to address a wide range of health-related social needs: housing support, medical respite, community reintegration transition following a period of incarceration, food and nutrition, employment assistance, non-medical transportation, and violence prevention and intervention. Getting approval from our federal partners is just the first step. Critical to the success of the work will be our interagency collaboration with our partners at DHS, the Department of Corrections, the Illinois Housing Development Authority, and more. This will be truly transformative systems work. We are also working to increase access to affordable health care with our partners at the Department of Insurance as we continue to develop and launch a state-based marketplace. As with the Children's Behavioral Health Transformation Initiative, this is another example of how we are working jointly with our sister agencies to create more seamless systems and access for people in Illinois. It is essential that we have strong coordination between Medicaid and the marketplace so that Illinoisans can be connected with the coverage that best fits their needs. Access to affordable health care is also at the center of a new initiative we are proud to take the lead on at HFS, to find innovative funding solutions for high-cost drugs and treatments, starting with sickle cell disease. Here, equity centers our work, as we recognize that sickle cell disease disproportionately affects people of color, particularly Black Americans. More than 40% of the Illinois residents diagnosed with sickle cell disease are enrolled in Medicaid, which means this work has the potential to greatly improve many lives. As we speak, there are new treatments, gene therapies, and drugs being developed and entering the market that have the potential to literally transform people's lives. But more often than not, when these breakthrough therapies become available, they're out of reach for many of the people who need them. At the direction of the governor, we are currently forming an advisory council that will issue essential guidance and input on effective, value and outcome-based models later this year. Our goal is to make these emerging gene therapy treatments affordable and available to all Illinoisans who need them. We're also proud to take the lead on another of the governor's initiatives to address healthcare affordability, the Medical Debt Buyback Program. Our budget for the next fiscal year includes a $10 million investment to eliminate nearly $1 billion in medical debt for roughly 300,000 Illinoisans. And it passed, both chambers. Layering medical debt on top of a healthcare challenge can be extremely stressful to navigate and can have not only long-lasting adverse financial implications, but can also make people more resistant to seeking future medical care. We're so excited to launch this program and be able to provide much-needed relief. Finally, I have to briefly mention the legislative session that just ended early this morning. We're happy to support the Governor's Healthcare Protection Act to hold insurers accountable for making sure Illinoisans can access the healthcare services they need and that there is transparency in authorization practices. We worked closely with the Illinois Health and Hospital Association and the Illinois Association of Medicaid Health Plans to frame critical prior authorization initiatives that will increase oversight, promote standardization, and reduce administrative burden in the delivery of emergency and other healthcare services. We also negotiated with key legislators, advocates, and pharmaceutical companies to pass legislation that will streamline access to prescription drugs that treat serious mental illness by eliminating prior authorization in certain circumstances. This is a significant step because it will remove a barrier that can impede critical and timely treatment. This bill represents a true compromise that will help our Medicaid customers. I want to thank all of you in this room for your shared commitment to improving healthcare in Illinois, and specifically to the millions of Medicaid customers we serve. It's a pleasure to be with you today, and I wish you a great day of policy discussions ahead.
Thank you so much. Really appreciate the comments. We have just a few more minutes, so I thought we'd go a little deeper on some topics here. Should be on already. So you talked a lot about interagency coordination, and you started with behavioral health, and now that you're in an agency, what do you see as the challenges, the biggest challenges to interagency coordination and some of the initiatives you've talked about today?
I think there are several challenges, but also opportunities. Obviously, I believe strongly in that. I think, what we see specifically with the Children's Behavioral Health Transformation Initiative is it is really 6 agencies that run a whole slew of separate programs, and they have different eligibility criteria, different rules and policies that govern them, overlapping and sometimes integrated, sometimes not populations they serve, and ultimately separate budget lines. And so, I think a lot of times people are working in state government are focused on getting the work done in their lane with all the right intentions, but you need to be able to step back and see how what the implications are in one program as it impacts the same people we're serving who are getting served in another program. And so, I think the great, what was so inspiring about the work with the Children's Behavioral Transformation Initiative, which is a mouthful, we should come up with another name, but is that the people who have been working on these issues in state government for years wanted to find solutions. And by being more intentional and looking critically and not having ego about any of the work, we have been able to make progress just through better coordination and more, intentionally working together. So it's difficult. State government has to be organized in some way. We can't just have one big blob. And I think often people hide behind the budget as something that's hard to get over, but we've seen there are ways to do it, and I think it starts with leadership at the top of in the governor's office and at the top of agencies to really impress upon staff the importance of being able to work across agency lines, because as I said, it's really ultimately about the people we serve, and they don't care what agency is doing the work. So.
A big culture shift, right, in terms of how the agencies work that way. Any example of a particular effort or program or recommendation that you followed through that made a big impact? Any case study that you feel really represents that kind of coordination that you would want to share here, either in that initiative or some other interagency initiative?
Well, I'll say, I've talked a lot about the Children's Behavioral Health Initiative, but I think I'll say 2 things. One, it really started out as this work group bringing the 6 agencies together, and they were like, probably some of you know, it was like a clinical team, right, working cases, because we had these situations that I know many of you have worked on with children with really significant needs, multiple diagnoses, and literally, their parents could not find somewhere for them to be. So they end up staying in the hospital too long, or, they're at home and it's a really bad, difficult situation. But it's very, very hard to find the right place. And so by working once a week together, working these cases, I think it was sort of like a learning process while we were helping. And they realized, well, because the agencies have various different contracts with different residential providers, well, DJJ might have a spot that a kid who's a DCFS kid could actually use. I mean, it was bringing resources together and learning all the while what could be changed to make the system better. I mean, out of that came the idea of the requirement that passed in legislation last year that all residential providers have to actually report the number of staffed beds they have available, which seems like a pretty basic idea, but was difficult because they have contracts with a lot of different state agencies. But it gives insight into capacity, so we know how much more we need to develop and incentivize. I worked a little bit on this in the governor's office. Just to give another example, is all of the work on creating a new early childhood education agency. I mean, that's sort of the other extreme, pulling pieces out of an agency and creating a new agency, which isn't something the state does often because it's really hard. But I think that's an area where it's obviously a top priority for the governor, and by combining funding streams for the services that are provided for early childhood education from DHS, from the State Board of Education, will allow those programs to hopefully work more smoothly. So
that's great. Thank you for those. I'm going to switch gears a little bit, and you talked about access, and you talked about the Medicaid redeterminations. Getting in out of a cycle of speedy review, 74% retained. That's terrific. I wanted to ask about what you're seeing sort of on the other side of the ledger. So what we've seen in other states is that as the Medicaid rolls have gone down, particularly individual coverage in the marketplace has gone up. So what are you seeing in that environment in Illinois in terms of the state-based exchange work, and what do you see as the connection over time between those two, the Medicaid and the individual market?
Well, that's an interesting question given what we're doing right now, right? I mean, we are finishing this year of unwinding, but we still have, I think I have my numbers right, more Medicaid customers than we did before the pandemic. So I think we're still going to see over the next year or so a continuing sort of effect of the pandemic, and we'll have to see how it plays out. At the same time, Illinois is creating a state-based marketplace, and we'll again have a more robust navigator program with more robust outreach. And we've been working very closely with our partners at the Department of Insurance on the plans for the state-based marketplace, including the Navigator program, which we are working on together jointly. So, but I think we learned a lot. I think everyone in here learned a lot through COVID and through all of the flexibilities that the federal government allowed for state agencies running Medicaid programs. And so we're also in the process of, and looking forward to more, making some of those flexibilities permanent to make it easier for people to enroll or stay enrolled, honestly, and to make it easier, on the back end for the bureaucracy to process these applications and redeterminations. So I think we are committed, though, to moving forward, making this process as more seamless, I think, than it is right now, so that when people go to enroll in Medicaid, well, if it turns out they're not eligible, they can go to the marketplace, or if they go to enroll in the marketplace and they're not eligible there, that it's a more seamless process to enroll in Medicaid.
That's great. So one last question for you. You've talked a lot about partnerships across agencies. In this room, we have a lot of other potential partners, right? We talked a little bit about the legislature. You've got health plans and providers and others here in the room. What kinds of partnerships do you think about in that space as you've taken on this new role with the agency? What do you hope the folks out in this room think about as they go into the sessions today?
Well, I think it's easy for all of us to sort of sit in our offices and do our work and not do the outreach and have the conversations, which some of them are hard conversations or they're hard things to listen to. I knew some of you when I was in the governor's office, but many of you I didn't know. And so I've really been trying to meet as many stakeholders and advocates as I can. I've gotten to some, not everyone. I hope to do more this summer and get out and about. And really, also I think it's critical. We're working on ways that we can get feedback from the customers who we serve as well. But I guess I would ask the same of all of you to bring your ideas to us and your insights. And we are open to listening. And I've said to my team, we're not always going to agree on everything. But I think what I'm really proud this legislative session that we were able to negotiate with several different constituencies to land on legislation that, maybe it's good. Nobody's totally happy, but everyone's a little bit happy. And I think that will help us make progress. So, I hope that we're able to continue talking and listening to each other to come up with the best solutions for the people we serve.
Well, that's a great closing comment, because this is all about talking and listening. Thank you so much, Director Whitehorn, for joining us today. We look forward to seeing you all in the sessions. Thank you so much.
Thank you.